Hello and welcome once again to Moorgate Andrology. Now in today's video we're going to talk about Peyronie's disease symptoms, what to look for if you think that you may have Peyronie's disease. Now in the early stages of Peyronie's disease, so-called the acute phase, the first thing you may notice in your penis is that you have pain, and typically pain on erection. Your pain could also be when your penis is flaccid, but lots of guys who come to Moorgate Andrology say that the first thing that they noticed at the onset of Peyronie's disease is that their erections were painful. So pain on erection is the first thing. Secondly, of course, is bending. And it's pretty significant bending of the penis in Peyronie's disease. Most guys have a penis which bends slightly to the left. That's completely normal. But in Peyronie's disease, we're talking about pretty significant bending. It could be 30, 40, 50, as much as 90 degrees. And when the bending is 60 degrees plus, it can make sexual intercourse very, very difficult and sometimes even impossible. And then that's the time that most guys tend to seek help. So this bending of the penis, your penis can be bent up facing towards the navel. It can be bent down or to the side, to the left or to the right. And the bending can, as I say, get significantly worse as time passes. The other typical point to raise is scar tissue. So when you have Peyronie's disease, you have scar tissue in the penis, and you may be able to feel this. You may feel it as a hard lump underneath your skin, and this is called plaque, a plaque of scar tissue, and this is what's causing the bending in your penis, because at that point, the penis loses its elasticity on erection, and this is what causes the bending. Penile shortening is another classic symptom of Peyronie's disease. So when your penis is bent, you can see that you have a long side of the penis and also a short side here. And typically it can cause penile shortening. Now, we have done other videos which talk about how we treat Peyronie's disease and the procedures available to protect the length of your penis. So take a look at those if penile shortening is something that is concerning you with your Peyronie's disease. Erection problems. Lots of guys also note that their erections are either difficult to get, or once they've got them, they're very hard to maintain, and there does seem to be a link with erection problems and Peyronie's disease. Some guys report that they started with erection difficulties before that they realized that they had Peyronie's disease at all. And finally, penile deformity. You may notice that your penis takes on rather an odd shape. For example, it could be shaped like an hourglass, or you have some sort of narrowing of the penis on erection. Another classic sign, another classic symptom of Peyronie's disease. Now, if you'd like to find out more about Peyronie's disease and the treatment options available, please do get in touch with us here at Moorgate Andrology. We can arrange a consultation for you with one of our urologists to decide, firstly, if you do have Peyronie's disease, and secondly, the best option to treat it. That's all from me today. Thanks for watching. I'll look forward to seeing you back here at Moorgate very soon. But until then, bye for now.